John and I have just gotten back from a week-long trip to China where we witnessed a total change in the Chinese policy toward fertility and having babies and pregnancy and abortion. Very, very exciting things are happening in China, and it looks like millions and millions and millions of babies are going to be saved based on the general model from the United States of helping moms in pregnancy in a life-changing way. Hi everybody, we're glad you're here for this edition of the Passion Life video blog podcast. John, how are you over there in Atlanta today?
Good to see you, Mark. Good to see you. It's good to be back with everybody.
Yeah, if you're anything like me, you woke up at about 1 o'clock this morning and couldn't go back to sleep because of jet lag. Did you have any trouble last night?
I did. I was up for about 2 hours, 2.5 hours in the middle of the night. We just got back from China. And very exciting, but it's a long trip, and it just, for some reason, going over there is not a problem, but coming home, it takes me several days to get my act together.
I'm the same way. Yeah, we haven't been home long at all, and we did have an incredible trip. It was really wonderful. And we're excited to tell folks a little bit about it today. Just for sensitivity reasons, I just will say up front, there are certain things that we can't say about our particular trip this time, but we learned a lot. We saw a lot. We saw some exciting things, and it was really kind of a seismic shift in our thinking for what we've seen in China up to this point. Pretty exciting, John.
It is. There's a new era in China right now.
Mm-hmm. That's right.
That is really aimed at promoting the birth of children after 35 years when the opposite was the case. And
exactly right.
Yeah.
So I've always thought that the people who love abortion, or at least want to keep abortion legal and accessible, were really brilliant in their successful campaign to term abortion healthcare. Of course, it results in death every time it's successfully carried out, but it's still packaged and sold as healthcare, reproductive healthcare. China has done something similarly brilliant as a way of saving face for the fact that they've been mandating that people limit their families with the one-child policy for so long, then the two-child policy, three-child policy, and now knowing that they need babies and knowing that they not long ago were forcing people into sterility and abortion, they have to figure out a way to change course without losing face. And the way they've done it is coming up with the phrase fertility protection, fertility enhancement. And I think that's just as brilliant.
Yeah, it is. It's a way of saying anti-abortion in a very positive way, of recognizing that abortion does reduce birth and it does cause infertility. Mm-hmm. So they have come up with a very woman-centered, health-oriented approach, calling it fertility protection, which I think is when it comes to wordsmithing, that's pretty good.
On their part, I think they did an excellent job, and I commend them for it, actually.
Yeah.
Because it does damage fertility to have abortions. Most people after an abortion, many people will have trouble carrying subsequent pregnancies, especially the first one after an abortion, depending on the abortion type, especially.
I think most of the research I've seen suggests that somewhere between 20 and 25% of women who have an abortion will have trouble carrying the next pregnancy to term. So that may vary in different parts of the world, but it's a significant number.
It is a significant number. And so the Chinese population is in jeopardy, and we're going to talk a little bit about that today. And I would love for you to kind of walk us through some of these PowerPoint slides that you've been able to put together.
Okay. Well, we were there in China to talk about fostering fertility in China. And so I had prepared some slides to present to a number of people there. And the idea is, again, fertility protection is another word for helping women have their babies in a healthy manner. So on this first slide of a world map here, this is a great starting point here. This is the state of global fertility. And just as you visually look at it, you don't have to see all the detail of it, but the bluer parts of the world are where people are still having babies sufficient to replace the dying off population and maybe even increase it. And the reddish areas are the places that are falling short of having a fertility rate that replaces the existing population.
Okay, so
you can see
this
that
replacement.
You got the U.S., you got Canada, you've got much of Russia, China, and all of Eastern and Western Europe are red, meaning they're all losing their population. They have a birth rate, a total fertility birth rate of below 2.1, which is what you need to keep the population even. And the only reason we don't see that so much in the U.S. is because we have so much immigration that it resupplies our population. But in many parts of the world, they are desperate, and certainly in China, they're down to a total fertility rate now of 1.02, and that is creating a lot of social havoc, and will continue to create social havoc for years to come.
And explain for us why you need 2.1 to maintain a population.
Yeah. Okay. So my wife and I get married, and eventually we die off. So to replace ourselves, we need to have 2 children. That's obvious. The 2.1 is to reflect the fact that not everybody gets married.
Right.
Or that not all the children survive to adulthood. So you need the 2.1 factor applied to the population at large to maintain the population.
And so that's what you're talking about when you use the phrase total fertility rate, or what we see on this slide, TFR. That's what you're talking about.
That's right, total fertility rate. And the only places in the world that are doing well are primarily Africa and some parts of the Middle East. Okay, the Muslim countries are still having children, and when we were in Africa last year, I always told the people, there, the Christians there, that in many ways they're helping the world by demonstrating that families formation and getting married and having children is the true value and fulfillment in life, and the rest of the world is rejecting these things, and they're going to destroy themselves over time. So that's the big picture. Okay.
Right. There are a couple things about this slide that are marginally, not necessarily misleading, but they don't paint the entire picture. For one thing, anything that's in the light blue, the lightest blue category, may or may not make it all the way to 2.1%. In other words, I'm looking specifically at the country just above China on this map is Outer Mongolia.
Yeah.
It's the country of Mongolia, and their total fertility rate, as I understand it, is very, very close to 2.1. So it could be blue or it could be pink, either way. And then you look at China and the United States, and they're the exact same color, but the picture is not exactly the same in those two countries.
Well, there's a lot of complexities to this, but this is a good snapshot of what we think is a growing global crisis, and many governments now have changed from there are too many people in the world to we don't have enough people in the world, and you simply can't sustain a society with a declining population. You need to have a growing population in order to have a sustaining economy and a social fabric.
You mentioned immigration, and you look at the fact that the United States has an aging population and not enough babies to replace. And so the idea there is that the economy has to be run on the younger people to sustain the number of older people that are not working anymore, contributing significantly to the economy. And in the United States, the we're not going to experience that as sharply because we have immigration to come in and supplement our workforce, whereas China really doesn't have immigration per se.
That's right. They are really in a downward spiral, and so there's a lot of geopolitics here about whether China is our enemy and all of that. Let's set that aside for a minute. Okay, the reality is that China out 10, 20, 30 years is growing weaker and weaker and weaker simply because they have a desperately declining population, and it can't be stopped. So let me show you this next slide here and kind of illustrate why that's the case. Okay.
Right.
So in this next slide, you can see the comparison about the number of babies being born and the number of people dying in China. And in the last year or two, you can see the lines have crossed so that there are now more people dying in China every year than are being born. In addition, you'll see that it's a rather dramatic decline in the birth rate since 2015, which is interesting because it was in 2015 that China kind of recognized that they were headed to trouble here. And they changed their one-child policy into a two-child policy. But it didn't work as this slide demonstrates. In other words, they had trained a whole generation of people not to ever want more than one child and to see children as sort of the enemy to their own prosperity and wealth rather than the fulfillment of their prosperity and joy in life. And so the decline has rapidly increased, and they increased it to a three-child policy during COVID, and it's still not working. So that's the situation. Let me take you to the next slide and show you some of the particulars. Okay.
Okay.
So here we see that in 2022 was the first time that they their demographic growth turned downward. They were always increasing in numbers over the last 30 years, even though they were having fewer and fewer babies. But that's only because the Chinese population was living longer. They had a higher economic standard. They were living better health care, and so people are living longer. But that runs its course and now has run its course. So now in 2024, 1.3 million people are living in China at the end of the year than at the beginning of the year. So that explains what more people are dying than are being born. And India has more people in it than China does.
Right.
And the last note is really almost the scary one. I put that in a circle here. The UN predicts, based on their demographics, that China's population will drop over 50% in 75 years. I mean, 75 years, that's not very long. Okay?
No,
they're going to go from 1.4 billion people down to 767 million people. Just imagine if the U.S. lost half its population over that period of time.
And I'm just thinking about the fact that, one person is going to people are going to live long enough to see the population of China cut in half during their lifetime. That is just astounding.
It is. So how do you, sell more cars if there are fewer people to buy them? How do you sell more apples if there are fewer people to buy them? There's fewer things that you can sell to less people, then there's less money coming in, and you have fewer and fewer people taking care of that older population. So there's all kinds of social havoc going on here in China and in other parts of the world. Russia, much of France and other countries are facing the same problem. South Korea actually has the lowest TFR rate in the world right now. So this is a global crisis. So China's gone from promoting abortion to this quotation I have here: marriage and childbirth are not only a family affair related to personal happiness, but also a major event for the survival and development of the country and the nation. That's what the government is proclaiming now. That's quite a change from when we started working in China.
It is an about face.
Yeah, yeah.
But we predicted this, John. I mean, we saw this coming. In fact, you don't have to be a rocket scientist to understand, and people understood a long time ago that something like this was going to happen. We knew that the demographics were in imbalance. We knew that there were more baby boys being born in China than baby girls, and that was going to cause a problem. We knew that eventually, limiting the population was going to result in an economic downturn. But I don't think anybody really saw the precipitous decline of babies being born dropping off as sharply as it has. They must have been most effective with their propaganda about the one-child policy right at the end, because young people got it in their heads they're not having babies.
Well, that's very true. And let me go to that slide now that you've mentioned that. There's a couple of data points that explain this. Here is a pie chart and a bar graph that basically says that the one-child generation now rejects and resists marriage as well as family formation. So behind the lack of children is another big problem, which is that as a cultural value now, young people of marital age are rejecting marriage. And women, I mean, there are already fewer women in the population already because of the one-child policy and the targeting of baby girls for abortion. So the survivors, the women who survived all of that are now also rejecting marriage and therefore rejecting childbirth. And
it's astounding.
It is. It's quite astounding. So the pie chart says here that 40% have a negative attitude toward marriage, 20% have a positive attitude, and 40% more of a neutral attitude. And when you ask for the particulars, I'll just take you through this next slide, why current incentives are not working. Among the reasons stated is that the current generation is postponing marriage, which delays children, and women believe that they have more lucrative things to do. As society became more prosperous, this is true in every country, by the way. When a society grows more prosperous, it automatically starts to have smaller families. More poorer, more agricultural economies have larger families out of necessity. They need more hands on the farm and so on and so forth. But as people move to the cities, they have smaller spaces and they have increase in income and things are more expensive. They automatically begin to lessen the number of children they have. So China never really needed to create these policies. It would have happened naturally already.
That's right.
But women now believe that they have better things to do than to get married. And they believe that having a baby kind of is an anchor in their life,
right.
Holding them down,
holding them back,
rather than fulfilling a deep part of what it means to be a woman and a mother.
These are sobering statistics, and I think when we come back from our break, we ought to talk about how all of that relates to what we saw and did and experienced and talked to people about and planned things for as we were in China over this last week. So let's talk about our trip to China a little more when we come back from the break.
The U.S. accounts for only 3% of the abortions that happen in our world each year, leaving 97% of the crisis before us as a world missions challenge. Would you join us in serving where the need is greatest? PassionLife, rescuing the most vulnerable where abortion is most concentrated.
As I travel all over the world, people commonly ask me what they can say and do to help a mother who's in a pregnancy-related crisis. And I always say to them, be ready to speak up and show them the simplest of things. Show them what their baby looks like. We call this the PassionLife Tiny Baby. It's what you look like at 9 weeks of age, and it's available. You can find more information about it on our website.
Well, as we mentioned, John, you and I just got back from a week-long or 8-day trip to China. Remind me how many times you've been to China yourself again this time?
Yeah, that was my 32nd trip to China.
That is.
I started thinking about how many hours I've spent on the plane just going to China. I think it's about 2 months now I've spent on a plane.
That's unbelievable. My leg from Hong Kong to JFK was 15 and a half hours on the way back. Yeah. And you think about doing that, not just 32 times, but 64 times. It's there and back. It's just a lot of hours on an airplane.
It is. It's exciting to go to China, and I love being there. I love seeing what God's doing in China. But getting there, I always say to people, I love my work. It's getting to work. That's the hard part.
Yeah, it's a terrible commute. It really is. And, I lived in China for 10 years. So it's so great for me to get back. You were so gracious to go with me to certain places to find just the kind of food that I need to find when I go to China. The out of the way noodle shops in the back alleys that are so delicious, not really touristy. We do have a good time when you and I go to China together.
Yeah, it's a beautiful thing, and China is an amazing country. The people are really amazing. And again, as you're watching this, you got to set aside the politics and think of missions, and to recognize that what God has done in China over the last 100 years is breathtaking in terms of the amount of souls that He has brought into the kingdom and the gospel, how it has spread across many parts of the country. And now we're seeing that Christians in China have more and more of an opportunity to begin to alter the culture in the way that Christianity ultimately does throughout its long history. It fights injustices, and it raises up the poorest of the poor. It takes care of the sick and the orphan and the elderly. And these are all, all these institutions, like hospitals themselves, were all created, are the good fruits of Christianity that impact a culture. And we're starting to see some of that in the rescue of mothers and couples from abortion in China in some very encouraging ways.
So we know that as the Chinese government understands the same statistics that you just walked us through here, that PowerPoint slideshow is nothing new to them. And they are changing their tune. They need more babies. They want more babies. And we saw some really, really encouraging signs as to how the government plans to go about that, or at least one part of how the government plans to go about that in the next few years. Why don't you explain a little bit of that to our friends here?
Yeah. Here's a picture of some of our partners in China that are part of the Qinghai Kungla Hospital. Did I pronounce that correct? Kungla?
Kungla. That's very close. Yes.
Okay. And what they did is they started a pregnancy help counseling office inside a communist-run hospital in their city. And that's right. The more we've analyzed this and some of the others that have started as a result of that, we've really come to see that the hospitals in China, if they were mobilized correct, could be the quickest and the least expensive and most effective resource for fostering the birth of children in that country. And there are 39,000 hospitals in China, and they are now all starting to learn about this model that's been created in China called the Pregnancy Help Counseling Office inside the public hospitals. Now, we don't do that here in the U.S., but
that's
it will work and is working in China.
I'll point out that you went to China 32 times, or have been to China 32 times. You and I met in China. We've been to China on some of those trips together over the last several years. And one of the things that we have been able to do is we've gone along the way and taught Christians and is to introduce kind of the model of pregnancy help intervention that takes place in pregnancy help offices in the United States. And we've got partners in China who have been paying attention to that. But it was not our idea to go set something like up in the hospitals.
Yes, it wasn't our original idea, but we learned how to seize the opportunity when it was presented to us. And
that's right.
And we were able to show them that what we're talking about, having a counseling office that a woman can coming in for an abortion, recognizing that about half the women who come in for abortion are ambivalent. In other words, part of them says, I need an abortion. Part of them says, I don't want an abortion. And if you slow people down, you give them real opportunities to think clearly about what they want, what the heart wants, provide some practical support, then a good portion of them will change their mind. We've seen that all over the world. In fact, one of the things that we did in China is we try to show hospital leaders and others that this idea is universal now. It's all over the world. So here's a slide that I use to show that there are pregnancy help centers created in all parts of the world now, and they could be introduced into China in a very life-saving way. So here's a picture of a sign, pregnancy help clinic in Spanish, and some mothers down in Colombia that were rescued. So we're trying to normalize this model, and we also introduced the fact that there are numerous approaches then that you could use. You could help women get pregnant who want to get pregnant. So we introduced them to the company called Pre-Mom that's working in India. It's working in like 25 different countries or something like that. And they have a goal to help 1 million women in China get pregnant this year. And then the other big thing before we run out of time here is to help women who are pregnant not have an abortion. And that's somewhere between 8 and 13 million women in China that are pregnant. And so here's an opportunity through this development of pregnancy centers in hospitals to help a great portion of those women find life-affirming alternatives that save the innocent and really give people an opportunity to find God's provision for their life.
Well, it's an exciting thing, and we experienced really exciting things. What would you say was the most exciting thing? Kind of give us a final word or a final thought as we wrap up our time.
Well, what I would say is that what we took 4 or 5 years to develop 4 or 5 centers, they're now going to be opening at a rate of 25 and 50 and 100 every year. It's just going to start spreading all over China. And then I think we can use the data to show other countries like India and really create more of a mass movement all over the world. So I really encourage you to join Passion Life, support us, pray for us, cheer us forward for the great work of the gospel of life.